all Honorable Chief Advisors Dr. Satyanarayan, Dr. Dayakar, and Dr. Venkateshwara Rao, respected Dr. Lingaya, Dr. Bhaskar Reddy, Honorable Dr. Ratna, respected AHA members, Dr. Sunil, Dr. Arundhati, and Dr. K.T. Reddy, and the entire management of AHA and Yashoda Hospitals. Someone very special and my inspiration, my guide, Dr. Prasad, and Dr. Ashwini Amreshwar, who keeps on reminding me to work hard and do well in life. I would like to thank all of them from the bottom of my heart, and thanks for this opportunity today, and it's a great learning today in this program. Thanks for all. Hello. Good afternoon. Today I'm here to speak about a subject which is very familiar at times, at the same time which is not very familiar also. That's called medical tourism. All of us in this industry, the budding young managers, and going to be the future, who are all there sitting right now, I would like to highlight a discussion point today, that is between medical tourism and after the arrival in India, what happens to the patients. It's a different topic actually. We as India, as a country, we are growing very well in medical tourism, attracting patients all around the world. But then there are certain challenges where when the patients travel to India and after coming here, what kind of services, what kind of situation they go through, and are we doing good? And how better we are doing, because in future the competition is going to be very difficult, and if we have to survive in the competition, we have to ensure that only quality services can attract patients, not the cost, which is maybe for last 10 years it was one of the biggest criteria. Now going forward, I would just try to give you a snapshot of what medical tourism is all about. Basically, as you all know, that when a patient is planning to go to another country for the purpose of medical treatment, and at the same time the intention of tourism, something called medical tourism is all about. There are various definitions available when you can go and just have a look on it, but the perspective remains the same, the objective remains the same. They go and take care of the treatment, because some countries the services are not that much advanced. So that's the reason they decide to come to India, and at the same time, there are some countries where the cost of medical tourism, the cost of their domestic treatment is so much they can't afford. So it's better to go to a different country. Now I would like to play one video which will give you an idea how it is happening.
With the cost of medical treatment 65 to 90% less than the US and Europe, India has positioned itself as a destination for medical treatment. The Indian medical tourism industry is expected to reach $6 billion by 2018, with the number of people coming to the country for medical treatment set to double over the next 4 years. The current size of the medical tourism industry in India, in value terms, is estimated at a little over $3 billion, with tourist arrivals estimated at 230,000 in 2013. Top specialties for medical travelers are cosmetic surgery, dentistry, cardiovascular, and orthopedics. Medical tourism is an area that the NDA government plans to tap to drive growth in tourism, and promised that it would build 50 tourism circuits, including a medical circuit, which will connect hubs of modern and Ayurvedic medicine. The medical tourism segment is projected to grow at a compounded annual growth rate of 20% between 2014 and 2018. India is ranked 5th among top medical tourism destinations, beat by Singapore at 4th, the US at 3rd, Mexico at 2nd, and Thailand coming in 1st. Indian private hospitals have a large pool of skilled doctors, nurses, and supporting staff that attract medical tourists, especially from Southeast Asia and the Middle East. All these factors are likely to boost the number of medical tourists coming to India to an estimated 4 lakh by 2018.
So now coming back to the main point. Today I am going to talk about medical tourism, because medical tourism we have been experiencing that business aspect of it, but at the same time how services are delivered. We as young administrator has got a real role play in that area to ensure the customers who are coming, the patients who are traveling from different countries should get the best services which can sustain the tourism aspect in the long run. Now we have seen India has started a big campaign, Incredible India, in 2002, where one of the statistics which I want to share is almost 100 countries is trying to promote medical tourism currently. And the last statistic says, which you have already seen, somewhere around 230,000 medical travelers comes to India. But what could be the business prospect in 2018? 2018 it says the current $3 billion business can be doubled into $6 billion. So if all that is good, my question is to all of you, is India the best place? And Indian hospitals are equipped to provide value for money. And third is branding of medical tourism versus experience in the hospitals. Now this is something which many of you will agree that India is doing well, but there is a part of Indian hospitals who has been doing good, but not entire Indian hospital who has been promoting. I'm saying they are in the market, there is so much said about medical tourism, and nowadays every new entrant hospital is trying to promote that and promoting as one of the branding strategy. But at the same time, it is not that easy to promote, because there is a lot of execution and operational challenge which is involved in that. And this presentation, we all will be discussing about the challenges and what could be the reforms in developing medical tourism in operations perspective, administrative perspective. Now first, yes, are we prepared? So what is the challenge becoming now in India? The challenge here is now, as Dr. Anil Jadhav also mentioned, that the patient is becoming more informed than earlier. Now patient has got access to internet. Now patient has got access to various connectivity to the world. They can reach out to anybody, any part of the world and get a second advice. And earlier patients were not that informed. So now it's a choice of patients to choose a hospital or not to choose a hospital. So it's now our challenge as a provider, as a hospital perspective, to ensure that we live up to the expectations of our global patients and give them the services which they can demand for or they just deserve for the price which they pay. Obviously, costing is one of the attractive elements, but at the same time, whatever the costing we provide them, we have to ensure that's subject of operational services. Now, what is the demand of global patient now? As I mentioned, the global patient now is definitely more informed. More intellectual patients. They ask questions like Dr. Jadhav said, a lot of questions to trouble doctors. Word of mouth, yes. Whatever expenditure we do spend in marketing, end of the day, the real value, the real attraction of next new patient always happens with the word of mouth. And for international patients, it is very important, because once they go back to their different countries, they should have that impression that they have had a great experience, so that they can tell 15 more people and come back. Even marketing can just attract some of the patients, not the end, not that they cannot create a new impression and an image of good quality, which has to happen only when the services are good. And that developing services, somewhere we are all responsible as an administrator. Yes, now we are shifting from another segment where care is not the only criteria. In earlier, patient used to come to hospital just for the treatment. Now, in medical tourism perspective, care is one of the criteria. At the same time, it's a part of a vacation. They can go for another tourism point of view. So all that different element has to be, all that dots has to be joined together, coordinated well, so that patients should not feel that they are here for the treatment and after the treatment nobody is there to look after. There are chances where now I'm sure many of you are reading newspaper that some foreigner has come to India, not treated well. They have reported some issues of security, some issues of medical interventions. So there are multiple factors involved. We have to handhold those patients to ensure that their whole experiences, whatever they experience in India, it goes well. Yes, they are more vulnerable in the sense nowadays, as you know, social media has become very active, and I mean I've been in this for a long time, so I can understand whenever a patient goes nowadays, like there is no feedback form. They just tweet, they just write in Facebook, they just tag you. So I mean all of you know that. So it's a very open and a public forum. So whether it's a good experience or a bad experience, they are very vulnerable. They can just do market you in a wrong side, at the same time in a better side as well. So we all need to understand those accessibilities given to the patient in today's world. And obviously care doesn't matter. What matters is experience. I mean, I'm sure when we started our life, we have had different interviews, job interviews. What questions been asked to us never there in our mind, but we remember how nervous we were there. Because word doesn't be there in your brain. You just remember how nervous you were, or what you are wearing, or how you are talking to the people. So it's like the memories are always the total comprehensive experience which a customer go through. It doesn't happen just the care part, because care is one subject to that. Obviously experience matter. Yes, so coming back to challenges. So what are the challenges basically which is associated operationally in medical tourism execution? There are, actually I'm going to talk about two different challenges. One is internal challenges, another is external challenges. Internal challenges, yes, one is hospital administration. Hospital operations and hospital administration, as some of you can connect very well with that. Like the first is, when we attract patients, when we brand medical tourism to different countries, we talk a lot about good things of hospital. We give a lot of commitments to the patient, and with that impression only, patient can connect to us and they travel to India. But then the first thing is, whenever the bill goes to their hand, they just get surprised. I mean, whatever commitment you do, so it is not the bill goes beyond their limitation. It is about the mutual trust which a patient should have, because they are spending so much of money and so much of time to just come to India for different hospital. And I'm talking about Indian hospital as in a bigger perspective. So what happens when they come here, and if the billing is not something which is very transparent, and it is whatever been committed, because most of the time, sometimes what we do, we just give them packages nowadays. That's the trend. And after that also, if there is a clarity issue, if the patients are not being informed well, if administrator point of view, if you are not been having a track of patients, not counseling them properly, not greeting them well, I mean, small little things can make them think that, okay, this hospital is not good, this hospital may be not up to the mark, and impression just creates within seconds. So somewhere the billing is one of the criteria where we have to be very careful what we are giving and how transparent it could be as far as possible. Second is logistics. What happened, I mean, on a personal side, sometimes you go for any holiday vacations and all, you book something through an agent, and when you arrive to that country, there is no one standing in the airport, and then you realize that what the hell is going on, because you are not going to accept that, because when the agent talks to you, when somebody talks to you, they give a very rosy picture of that don't worry, once you go there will be somebody who will be able to escort you, take you to the place and be there for you as a guide. But similar to hospital perspective also, when a patient arrives, at the airport itself, from the airport to the hospital, there should be connectivity, there should be people available, there should be hand-holding so that patient feels comfortable. And all those small little things matters a lot. It builds up the reputation of the hospital, not just the marketing hoardings, because these are the real-time experiences. Second, yes, I mean, I'm talking about the situation now sometimes happens. There are a lot of people who comes in between medical tourism. I mean, how to term them? They can be agents, they can be consultants, they can be facilitators, and with that, new people and terminologies, new people entering into the business. What they do, sometimes they take an advantage of a patient and divert them to different accommodations which is not safe, maybe high, and try to manipulate things which is wrong. Some of the hospitals bring patients from Middle East and some other countries where English is not being spoken well, and if you do not provide them good interpreters, if you do not provide them translator support, then what will happen? Whatever simple procedure you are doing as well, you are not able to communicate, you are not able to counsel the patient, and there the confusion starts. Not only to the difficulties to the patient's perspective, the satisfaction perspective, but at the same time, the mindset that this hospital is not equipped to handle me, which is wrong, because both the care providers, doctors also get upset, and at the same time, the patients always be getting upset. Fourth, which is very important, I want to highlight that is BD team, that is business development team, which is there in hospitals. What they do for their best of their efforts, they give a rosy picture. They just try to promote as much as possible. We will be available, we are there, you just be there in the airport, and then we will be taking care of every second of yours. But once they are in airport, once the patient is registered, and after that, very difficult to find them. Sometimes, I'm talking about from a broader perspective. So what happens, whatever they commit, whatever the image has been given, the real challenge is with us, who are the real administrators, who are the operations people, who just try to ensure that whatever the impression is being given, we have to live up to that expectation. So there is a challenge there to live up to that expectation, because there is no